Want to study in Germany? Then Excella is the best option. Admissions with scholarships available. Call 9881 96666.
కాంజినెంటల్ హార్ట్ డిసీజ్ అంటే ఏంటి? కాంజనైటల్ హార్ట్ డిసీజ్ అసలు ఎందుకు వస్తుంది? ఇది ఎవరిలో తరచుగా కనిపిస్తుంది అనే అంశాల గురించి మనతో మాట్లాడేందుకు ప్రముఖ కార్డియో స్పెషలిస్ట్ కమాల్జీ మనతో ఉన్నారు. కమాల్ గారు నమస్తే.
హలో, నమస్తే అండి.
సార్, ఈ కాంజనైటల్ హార్ట్ డిసీజ్ అనేది ఏంటి? అసలు ఎందుకు వస్తుంది? ఎవరిలో తరచుగా కనిపిస్తుంది?
See, congenital heart disease, actually you have asked me a question in 3 parts. I'll answer them one by one.
Yeah.
First of all, the first part is what is congenital heart disease? Like what actually it is. It is a heart disease which is present in the children from birth. They are born with this heart disease and they are having that heart disease as soon as they are born. But they can be diagnosed at a later age. It is not necessary that heart disease will be diagnosed at the time of birth. If it is severe enough, it can present at the time of birth also. It can produce later when the child grows, maybe after 6 months, maybe after 3 years, and even in the adolescent or adult age groups. But the problem the child is having since birth. So this problem is known as congenital heart disease. The second part of your question, how common it is.
Yeah.
Because we are talking about it, it should have some relevance. If we see in our country, India, every year approximately 250,000 kids are born with this congenital heart disease. So that puts a huge burden on our population. And if you see of the total deliveries, out of the total 100 deliveries, one child is born with a congenital heart defect in it. That is, he is having the birth defect in heart since he is born. I'll now go on to answer your third part of the question, which asks about what are the causes of congenital heart disease.
Yes.
So frankly speaking, if you ask me for the causes, in up to 80% of the cases, we don't know the cause. We don't have anything that a cause can be attributed. Some of the causes which have been attributed are due to genetic causes. There is some genetic issues in some of the genes. Some syndromes are there. Those are causing. Any child who is having like his sibling, his brother, sister, or parents or any grandparents and all are having congenital heart disease, they are having some heart problem, then that child has some risk of having that congenital heart disease. They have seen that if the mother has certain infections during pregnancy, like rubella infection is there, like CMV infection is there, those children are also found to have congenital heart disease. In some of the cases, the mother is having some disease like diabetes, sugar is there, or some metabolic disease like phenylketonuria is there, some disease known as Sjogren's syndrome is there, SLE is there. Those kids are also known to have congenital heart disease. So these are some of the causes which have been seen. If you talk about nutrition, anyhow, if there is any role of nutrition in congenital heart disease, then I can say that those mothers who smoke or take alcohol, the chances of having congenital heart disease is increased in those kids. Second, it has been seen that folic acid, this is a type of vitamin B, which is found, it has been seen that they have a role in producing congenital heart disease if there is deficiency. So these are some of the causes which are approximately only 20% of the cases in which we could find some cause. But in up to 80% of the cases, we don't have any cause. They are attributed to genetics or syndrome.
ఓకే కమల్జీ, థ్యాంక్ యూ.
Thank you.